Alright, so I'm going to walk in and I'm going to introduce myself. Hi, my name is Isaac Suarez. I'm a student nurse. I'm going to be taking care of you. Before we get started, could I have you state your name and date of birth? Your name is also Isaac Suarez, birth 7/16/93. Perfect. And I'm going to provide some privacy and I'm going to perform my hand hygiene. Before we get started, are you in any pain? Client states he's in no pain on a 0 to 10 pain scale. Perfect. So I'm going to get started. So before I get started, I'm going to limit distractions and noise. So we're going to turn off the TV. I'm also going to turn off the radio if there's any radio present. I'm also going to get this bed into a comfortable sitting position. Also, I realized I had left the door open, so I'm going to close that and provide you with a little bit of privacy. Oh. Close that. Alright, so as we get started, I'm just going to start at the head. I'm looking for any signs of edema, any jugular vein distension. So could you turn your head towards me? No, don't see any there. Oh, don't see any jugular vein distension there either. I'm also going to check these mucous membranes. So I'm going to be checking in the nose and in the mouth. Perfect. And there's no signs of port perfusion there. So as we start to go down into our focused cardiac assessment, I'm going to expose your chest so that I can get skin-to-skin contact. All right. Perfect. So, stethoscope. And I want to clean my stethoscope prior to use. So I'm going to be checking the aortic. So I'm going to go into my second intercostal space. My aortic gets 2, so 1, 2. You don't want to be right on the sternum, so you're going to come over just a bit. Perfect. And I only have a diaphragm. The bell itself is, the stethoscope works off pressure, so I'll be pressing harder to get the different frequencies. And then I'm also going to check the S2 pulmonic, so I come back down into the second intercostal space. And I'm checking that pulmonic. I'm going to check the tricuspid, so that we're going to come down into the fourth intercostal space. So 1, 2, 3, 4. And we got that tricuspid. As we come along, we're going to check for the apical pulse as well as the metrial and the point of maximum pulse. So I'm going to fill here. It's going to be 5th intercostal space, midclavicular on the midline. So that's right below the nipple line. Come here. Feel that, that's pretty strong. And because I can feel that, that's the PMI. To get this apical pulse, I'm going to roll my client into a supine position and then over onto their left side. And I'm going to check this for 1 minute.
You want to watch Sam for us?
That's why she's like, make sure you're good. Make sure you know exactly where it is. patient back into a comfortable sitting position. Where's your shit? They're actually comfortable like this. So I'm gonna clean my stethoscope again. They had a capable pulse of 62 beats a minute. I'm also going to be checking their carotid pulse. That's strong and bounding at 2+. So when I come down, I'm going to start checking the extremities. My client, I had taken the blood pressure prior and it was 120/80. I'm also checking skin turgor, and there's no tenting. Skin is also pink, warm, and dry. So as I come down, I see no lesions, I see no edema, so I'm going to note the edema as a 0. I'm checking the pulses bilaterally. Radial pulses bilaterally, they are 2+, strong bounding. I'm also going to be checking for a capillary refill. So I check cap refill, that's less than 2 seconds, and there's no clubbing of the fingernails, which I like to see. As I check the lower extremities, I'm going to come down, I see no lesions, I see no hair loss, and I'm also checking there's no edema. So I'm going to note the 0 edema. I'm going to be checking pedal pulses also, and they're equal bilaterally. There's no clubbing in the toenails either, and I'm going to check capillary refill. Capillary refill is less than 2 seconds. So I'm going to get these bed rails back on up for my client. And I'm going to lower this bed back into a safe position. I'm going to put the call light within reach. Is there anything else I could do for you before I get on out of here? No? Okay, so I'm going to perform some hand hygiene on my way out. And
yeah, is there
document appropriately.